Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, Dr. Mencia, we're here again on a Saturday morning.
Yes, we are.
We've made a habit of this, you know.
Yes. I look forward to Saturday morning.
I do too.
I look forward.
But I also
you.
look forward to all the fantastic guests that you bring.
I just got to Las Vegas. I see these people dancing. What do you used to do? I used to be a surgeon. Come with me.
So who did you bring this morning?
I brought Dr. Ariel Rodriguez, who is a general surgeon, but he also has a very high interest in bariatric surgery, so he had been trained.
Tell people what bariatric surgery is. They don't really know that.
Well, bariatric surgery is for those people that are obese, with excess amount of weight that is taking a toll on their knee, make them depressed, create a lot as a complication of obesity. It creates a lot of medical complications that come right along. And when we look at the statistics, a lot of those patients that are extremely obese, excessively obese, we know that diet and pills and exercise is almost impossible, after a certain level. The solution, had been bariatric surgery. And then we will have Dr. Ariel Rodriguez give us an explanation of the type of surgery that we have when it comes to bariatric surgery. Good morning, Dr. Rodriguez.
Good morning.
I want to tell you, because I know people are listening about this, there are people who are very overweight. I mean, this is not just like ever 20, 30, even 50 pounds, but very. And they'll say, I always go on a diet and I don't eat anything and I still can't lose any weight. What's the response to that, please?
Well, good morning. Thank you for having me. This is very exciting for me. And obesity is one of the biggest problems that we have in the country right now. It's affecting a lot of...
It's an epidemic.
It's an epidemic affecting over 1 in 3 adults. But most importantly, it's affecting our children. And our children are getting obese. And they're growing to be obese adults. And they basically their whole life is going to be affected by this disease. And
it's a disease?
It is a disease. The AMA finally recognized it and pushed it as a disease. And now we should be able to talk about it like we talk about heart disease, like we talk about knee pain and everything else, because there's been a lot of taboo about it too.
And being a disease, that means that the insurance will cover
correct
the cost of the procedure to treat the disease, which is important.
Correct. The insurance company usually take a little bit of time to change their policies, but we're pushing very hard, so everybody should be covered about obesity treatment, including surgery and other treatment modalities. Okay,
but going back to the thing that I said, because I mean, it's true, because I know they must be embarrassed. I mean, I'm talking about people that when they go in an airplane, that they need 2 seats.
Correct.
So tell me about those people when it's so easy for us to say, well, why don't you just go on a diet?
Yeah, there's have been a lot of misconceptions about obesity and how we get obese. And we used to think it's all depending on what we eat and what we're doing, calorie ins, calorie outs. And we have shown for decades that doesn't work. I mean, if that was the truth, just by stop eating, like your friend said, they will lose weight, and that doesn't happen. It's a very frustrating process because it's very complex. There's a lot of hormones involved. There's a lot of signals from the brain. There's a lot of metabolic changes in your body that basically just start storing energy and putting out fat and putting out fat and putting out fat. And then once that process starts, it's very difficult to reverse.
And, a lot of the patients, when they come to my center, I look at the BMI and we tell them we have 2 dietitians available, covered by your insurance, that we can work with, and they will go in and get a consultation, and then they will never go back. And I say, wait a second, that's your coach. You have to work with your dietitian. You have to take the advice. You attempt to do some of those things. You go back. You continue. It's a process. There's no magic. So just like you come and get your blood pressure checked with me and get your prescription refilled, you have to every 2 or 3 months follow up with a dietitian, and sometimes even sooner. when you are attempting to use dietary as a method of losing
It's a
weight.
prevention, actually, isn't it?
Absolutely,
Using it.
absolutely.
But
And
just,
even my patient, when I'm going to refer to Dr. Rodriguez for bariatric surgery, I like to work with them for 2 or 3 months to make sure that they are already in a program of weight loss before he even does the initial consultation. And then if we need psychological consultation, it's a whole team that we're later going to talk about, the team that come together to help Dr. Rodriguez, each of his surgery becomes successful.
well, Dr. Ariel Rodriguez is a bariatric physician. We're glad he's here. But I wanted to go back to you for 1 minute, Dr. Mencia. We use the words BMI. Will you explain to people what that is, please?
Well, that's the metabolic index, the basic metabolic index, and what we are looking there is at the patient weight and the height, and in some of the formula, the age is put into the formula to come up with a BMI, and then we take the BMI. If a person is under 18, we call that person is anorexic. It's below their ideal weight for their height and the way that we expect on that person. If they are between 18 and 25, they are within the normal range. And then above 25, then you go into overweight. Above 30, you go into obesity. Above 40, I believe, is morbid obesity, and so on. So we take the BMI, just like before we used to take Coumadin, and we used to check the blood thinner. Now we check the INR. For the Coumadin, it's an international number that we use, and it's more reliable. So the BMI, when it comes to obesity, becomes more reliable, although it has its pitfall. Yeah. A person that is very muscular can have a BMI that look like the person is obese, but it's all muscle. So there are things that you need your doctor. You cannot just go and calculate your BMI in a computer. Don't go to Dr. Google to calculate your BMI.
Oh, you can't, because people do that.
A lot of people go to Dr. Google. I'm planning to work with the hospital. We're going to create a Google hospital.
Okay, so Dr.
But we didn't get into the definition. I wanted Dr.
So Dr. Rodriguez, thank you, Dr. Mencia, because, a lot of times we use these words, these symbols, and people don't really understand it. So let's talk about an average person that comes to you. An average isn't, is an overweight. Right. Is 100 pounds, 200 pounds. What is your average overweight patient?
Unfortunately, we are seeing them. They come a little bit bigger and bigger, and it's like as we talked about it earlier. It's just very prevalent and getting worse. But our average patient have to lose somewhere between 80 and 100 pounds to go back to their normal index, like Dr. Mencia was saying. So for basically for every height, we calculate what would be the ideal weight for that person in average. It's not perfect, like we were saying, but if you're 60, 80, 100 pounds over that, definitely surgery is one of the only methods that will get you back to where you need to be.
Because, we see on television all these diets. Right. I won't mention the particular one. And, I was 100 pounds and now I'm only, I've lost all this weight. I lost 100 pounds and on this food. Right, I don't know about that.
It's definitely doable. We hear stories of people that go on these intense programs of diet and exercise, and it's definitely possible. And there have been a lot of people with a lot of success, but the key word here is maintenance. Right. Okay, you did it once. Now, can you maintain it for 10 years?
Right.
And that's the difficult part. not a lot of people do that. Even one of the biggest problems, the bigger loser, you see them, that they lose a lot of weight and they're very successful for that year. But let's do a follow-up. What are they doing 5 years after? What are they doing 10 years after? So, right. Are they doing better than my patients is my question.
Right.
So that requires, when you decide that surgery is the proper procedure, what does that entail? They don't just come one day and you say, okay, we're going to do surgery.
It's a process. We want our patients to first understand really well, become very educated about what they're getting into. Have their conversation with their primary care physicians, and like Dr. Mencia said, have a discussion with the nutritionist, with the psychologist. Make sure that we address all the issues that are, contributing to the obesity problem. And then we have a long conversation. I mean, what are your goals? What are you trying to achieve? What are the risks that you're willing to go through? With some patients are very risk adverse and they really don't want to go through surgery, but there may be some other options that at least we're willing to consider.
And then you have the patient that come with very high expectations, so we have to bring them back to earth.
Correct.
And say this is what really can transpire from the surgery.
Yeah, that's a very good point, Dr. Mencia. Expectation management is usually one of the biggest problems because, like you said, you have a lot of patients that come very excited about, I'm going to do this, I'm going to do that. And then they realize that to obtain that goal, they had to put a little bit more work than they intended to initially. And then, disappointment and frustration sets in, and we just need to keep talking to them and keep coaching them and, take them through and explaining all that. There's a lot of talking that goes into it for surgery.
I remember in the 90s when my patient will go for gallbladder removal, we used to make that huge incision that once we saw that cut, we knew, okay, your gallbladder was taken out. And bariatric surgery, nowadays gallbladder get removed with a little incision by your belly button and one on the midline and one down here. Bariatric surgery, I mean, is that a huge incision that I'm going to have a scar on my stomach?
It has changed a lot, and I think that has helped patients are willing to go through the process now because it's small little cuts. There's about 4 little incisions, about keyhole ones. And we just be able to do
all the surgery
like that, thanks to the advancement in technology.
Oh, wait. Now I'm trying to picture this. So you have all that, it's like a straw, all this coming out, and I can't tell you.
Well, we have different procedures. All of them require at least 4 or 5 incisions. We have, for example, the laparoscopic band or adjustable band. Was very popular few years ago, and there's still some patients that can benefit from that. It's basically we just put a plastic device around in the first part of the stomach and kind of restrict how much you can eat. Then we have the sleeve gastrectomy, which is the one that we've been doing a little bit more in the last few years, where basically we make a banana shape or cut the stomach in a banana shape. We're removing about 60-80% of the stomach. And then we have the gastric bypass, which is the one that was done with the big cuts years ago. Now we do it with small incisions. And basically we make a little pouch about 20 ounces. And then we reroute how food goes to the body, so not everything that you eat gets absorbed. And you cannot eat as much. So that double action promotes weight loss on a very effective, a very safe way with long results.
And once the patient have the surgery, how much weight, how soon, and how much weight you expect them to lose?
Well, depending on their starting point, but we talk about excess body weight loss, which is just a technical term, meaning that if you need to lose about 100 pounds over your ideal weight, surgery can probably achieve somewhere between 60 and 80% of that. Okay. The first year is very rapid weight loss. Some patients lose 100, 120 pounds in the first year. In the second year, they kind of maintain it. After that, there's a little bit of going back to normal. If you eat too much, you're going to gain a little bit. But with the coaching and the system, the coordinators and the primary care physicians and the nutritionists and the psychologists, with constant communication with them, we can just fluctuate and maintain.
Now, after the surgery, there's a lot of skin that will be lagging and hanging all over your body. Would that be covered under insurance to get that removed?
Well, it depends. Some plastic surgeons are able to do what's called medically necessary procedure when that excess skin becomes a problem with infection and constant inflammation or rubbing under it. And at that time, which patients usually want it right away, but the right thing to do is wait for the weight loss to be stable, which usually takes about 2 years. Once they're at a steady state, then surgery is more successful, because the last thing they want is having one surgery, then lose more weight, and then having the same problem that they had before it. So, we tell them to wait about 2 years, and then they can have a consultation with a bariatric, knowledgeable plastic surgeon that can do.
We have a lot of people in the audience that have the gallbladder taken out laparoscopic,
Correct.
and they know how easy the procedure is. That people
Correct.
go home the next day. I have a joke. I tell you, my mother-in-law.
She's not
her
listening.
friend,
That's right. She's
not
not. Yeah, I
listening.
know.
She's in heaven now.
I
She's
know.
in heaven.
I know. It's okay.
My mother-in-law, her friend went to the hospital, and they will not release her because they will ask her, "Did you eat?" The friend will go, "Nope." "Are you passing gas?" "Nope." So my mother-in-law went in for the gallbladder removed, and it was laparoscopic, and that was Northridge Hospital when it was open. So she goes in, and I was her primary care doctor. So I go and see her, and she's ready to go home. I said, "You've been discharged already?" She goes, "Yeah." So I go to the nurse. "Is she okay? Did she pass gas?" She said, "Yeah, she passed gas." She ate. So I go in, then she's home, and she's calling me, "Could you come home and see me?" I say, "Why?" "No, yeah, I just want to make sure that I'm okay." "Did you pass gas, man, when you were?" She said, "No, but I know what happened to my friend."
Well, that's
Did she want to?
But going back to our patient gallbladder removal, most patients that don't have a son-in-law, they say don't and learn their way out. It's usually a very simple procedure, and people are in and out. So with the bariatric surgery, recuperation should be very fast then.
Yes, some procedures they go home the same day. Some procedures they stay in the hospital 1 or 2 days.
Really? I thought it would have been much longer.
No, things laparoscopic have made advances in pain control, and we know what to expect, and we know obviously not every patient is gonna be able to do that, but most of our patients are okay with that, and the important thing is constant communication. When everything is okay, everything is okay. When something is not okay, we are the first that need to know.
No, I tell you, a lot of the listeners out there that say, "Wow, I've been dying to lose weight. Maybe this is my route, what I should be doing." Who is a ideal candidate for the surgery, and who is not a candidate for the surgery?
It's a good question.
Yeah, well, first of all, for our listeners, I will say you have to have that conversation with your doctors. It's
but
the
sometimes
time.
the doctor, let me tell you about the doctor. I'm a patient advocate. Even though I'm an MD, I'm a patient advocate.
Yeah.
You have to defend my patients here.
Correct.
Because a lot of times you go to the doctor and you say, "Oh, your sugar is 120, it's above normal. It's okay. You are 80 years old, it's fine." Or I have arthritis. "Oh, it's okay. You're going to be fine." Now, sometimes you need to be an educated consumer
Correct.
when you go to that doctor.
That's
because
correct.
that doctor might not be your best friend when it comes to weight loss.
Correct.
And that's why we have an epidemic.
That's
Sometimes the doctor might be more obese than the patient.
That's correct too. Well, a lot of things have changed, and our patients certainly have become more educated, and they're reading more, and hopefully they become more
Are
aware.
they listening to you?
Hopefully, hopefully. I love it when the patients come to me and they think they know more about what I do, because we can have a good conversation and go into the
conversation.
details.
Dr.
Yeah,
Google
well, it's good and bad. I like my patients to know everything, the good and bad. But the ideal patient is the ones that are gonna get the most out of the surgery. Are the ones that have a higher BMI, meaning that for their height, their weight is either between 60, 100, 120 pounds over that limit. BMI, which they have to become familiar with that body mass index, it's usually above 35 or 40. The ones that have hypertension or diabetes, because those are the two most prevalent things that are gonna get resolved after surgery.
Mm-hmm.
And those patients that even if their weight is not that high, but their sugars are very difficult to control, and more insulin despite the nutritionist's best effort, and they're following all the instructions, sometimes they just struggle, and their bodies and the insulin resistance just becomes worse and worse. Those are the ones that are going to be taking the most out of surgery.
Yeah.
I think I have to give phone numbers.
Oh, yes, that's a good idea.
Are you going to be working today?
We are both working together. Both office, Boynton and Fort Lauderdale will be
Amazing.
open
Okay,
today.
so here we go, everybody. Remember,
Both
this is
medical and dental are open.
medical and dental. So this is Pencil Talk Radio. Get your pencils out. If you haven't written it down now, I think you should tattoo it on your somewhere on your body. Okay, phone number for, maybe this is Tattoo Radio. Okay, so now the phone number, of course, in Broward County is 954-489-1345. That's where Dr. Mencia is going to rush off right after the show, 954-489-1345. Now, if you want to go to Boynton, it's 561-270-6494. 561-270-6494. And, of course, we're talking with Dr. Andy Mencia, who is the geriatric physician and the founder of the AGI Medical and Dental Centers. And our guest today, Dr. Ariel Rodriguez, who is a bariatric surgeon. And if someone wanted to contact you, Dr. Rodriguez, what phone number should we give them?
Our office is 561-358-1399.
All right. And Dr. Mencia, of course, would always know how to get in touch with him. And
Right.
and we always recommend that you do this through Dr. Mencia, because you do want to have Dr. Mencia attest to that you are the proper candidate.
Absolutely.
Correct.
And I'm, as a Taekwondo grandmaster, I'm very prompt toward weight control and healthy living, but not too many doctors are. And if you have Medicare, Medicaid, or you have a PPO insurance, you can come and see Dr. Ariel directly. So for those patients that do come to the center, we'll be happy to refer them, Dr. Garcia or myself, refer them to Dr. Rodriguez for a consultation. But if you are concerned, like we said before, sometimes the doctor is not on your side, unfortunately.
Yeah, well,
And
you
have
and
to take initiative. And the indication is very straightforward. If you find yourself being 60 to 80 pounds or more or above your ideal weight, go and do a consultation. Besides seeing your dietitian and following, a healthy life. Those people that are overweight and have diabetes, in one of the studies with gastric bypass surgery, it showed that diabetes was completely reversed
Amazing.
In 36% of the patient, and partially reversed in 28% of the patient. So completely reversed, the person now follow a healthy diet. They don't have to follow a diabetic diet. Partially reversed, those people have to follow either a diabetic diet or they have to take a pill instead of taking insulin now to control the diabetes. And that's the amazing thing. That's over 50% of the diabetic that you have already knocked off the radar to live a normal life.
I know we only have a couple of minutes left, but Dr. Rodriguez, one thing I asked him is, why did you become a bariatric surgeon? And he told me, well, you can just share, and if you can do this in 2 minutes.
Yeah, I just like to fix things with my hands, and that's something that I really enjoy. And when patients come and they have lose their weight and they live in happy life and they're enjoying life instead of just going through it and going back to doing things that they couldn't do because of their weight, it's just an amazing thing to be a witness of.
Yeah, and the other part, and we don't have time to talk about that now, but I asked him what heaviest person he operated on. The person was 750 pounds. And Dr. Mencia said yes, and you remember the person that had to be taken out by the window of his apartment building in New York. So my advice is, let's not let you get that overweight.
Correct.
Why don't we first go to Dr. Mencia's, if you still have a chance, maybe to just do this through nutrition. And then if you can't, Dr. Mencia will certainly recommend that you go to see Dr. Rodriguez. But, of course, knowing that the show is, this portion of the show this morning is, of course, a wonderful world of wellness. And wellness is really prevention. In fact, I saw something that you said in your, what are the positive impacts on quality of life? That's really very, very important. Optimizing longevity through wellness and prevention.
Yes.
That's your motto. That's really good. And by the way, Dr. Mencia will be one of our wonderful distinguished speakers at our upcoming Cure Symposium on October the 24th at Palm Beach State College in Boca Raton. We'll talk more about that. But thank you, everybody, for being here this morning.
We have to bring him again.
Okay.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.